Across Erie County, thousands of people are fighting quiet battles with mental health, addiction, poverty, and trauma. Every day someone needs support. Every day someone steps up to give it. Imagine a career where your work helps young people grow emotionally, socially, and behaviorally in the places they live, learn, and play. That's the world of Intensive Behavioral Health Services, or IBHS.
Intensive Behavioral Health Services, or IBHS, is a team-delivered mental and behavioral health service for children and youth across Pennsylvania and may include multiple professionals working together to support each child's unique needs. One of the really important things it does is it brings the clinician to the client. For IBHS, the clinician comes to the child and the family and deals with the behaviors where they're happening. So in school, at home, in the community, they will come to the child and work with them and work with their family and teachers and any other caregivers. So it's very, very hands-on and very different than you might see in a clinic setting. It does have an intensity. You're coming into somebody's home, you're looking at what's going on with them. And because it's intensive, it typically happens several hours every week. So it's not something that's just a once a week kind of thing, as well as it's not intended to be long-term. So we're going to be teaching them the skills. They can learn them in their environment and then really use them when the clinician's not around. There are three main types of IBHS services: individual services, applied behavioral analysis or ABA, and group services. When we're looking at individual services, we're looking at a treatment that is going to happen with one child and their family or any other caregivers that are involved. But it's going to be focused on that child's behavior and their behavioral needs. When you look at ABA services, then you're dealing more with a very structure and data-driven treatment that is going to be all around skill building. And this is going to be something that's used with a child that might have some neurodevelopmental issues. That might be a child with autism, it might be a child with intellectual disability, it might be a child with ADHD that has a bunch of neurodevelopmental issues that are interfering. We also have group services, and for group services, that is a treatment that is going to happen with a group of children working on certain skills, working on certain behavioral problems, certain issues that they all have, and they're going to be working together with a clinician and their peers to learn these skills. The nice thing is that with IBHS, you can have a mix. So it's not that you either have individual or you have group. You could have a child who was getting group services, but then also dealing with their behavior at home, and they could be getting that through individual services or through ABA and get a full complement that handles all of their needs. IBHS services are delivered by professionals with different levels of training and education. So the behavioral health technician, or BHT, is someone who is going to have a high school diploma or a bachelor's degree, and depending on what type of child they're working with, they may need additional certifications. But they're going to be working under the supervision of a graduate level professional. They are going to be hands-on with that child, the teacher, the parent, and they are going to be the one on the ground, and it's a really nice career place for someone who's starting out. Now, there is a role for a behavioral health technician that is with the ABA services, and that is going to be that person who is going to be dealing much more with the neurodevelopmental issues. So they're still going to only need a high school diploma or a bachelor's degree in a related field to psychology, but they are going to need that additional training to make sure that they understand how to use these techniques and these interventions with this child and this family, because it is a very specialized service. Another role that exists is the Assistant Behavior Consultant Applied Behavioral Analysis. This is somebody who is going to have a bachelor's degree, so they can't just have a high school diploma. They are going to be helping the graduate level professional in really managing care and in setting up that treatment plan, as well as really giving some guidance in the moment to what should be happening. So they're just a little bit above the technician, but they're not at a graduate level. So it's a place where you could start a career if you already have your bachelor's degree. If you're looking at what undergraduate degrees might be a good fit for IBHS, we're going to be looking for undergraduate degrees that are in psychology, education, early childhood development, counseling. We are also looking for graduate level professionals. One of the first graduate level professionals to talk about is the mobile therapist. And the reason we call it a mobile therapist is because they're doing therapy in the home. Now, that doesn't mean that that's all they can do, because they can write treatment plans. The other roles definitely focus much more on behavior analysis and much more about skill building. And the behavior consultant is going to be looking at what happens, looking at the data, watching the BHT work with the child, watching the caregivers work with the child, figuring out what skills are still needed. And when we look at the behavior analysis, they are going to have a level of skill training that is going to be above and beyond the mobile therapist or the behavior consultant. They are going to come in with a serious amount of behavior analysis, information, and certifications so that their level of what is happening for that child is going to be at a higher level. For the graduate level degrees, we are definitely going to be looking for master's or doctorate level, but they're going to have to be specialized in things like social work, psychology, counseling psychology. So when we're looking at the career path for IBHS, you can start coming straight out of high school with just a high school diploma and become a behavioral health technician. You can also do that if you're coming out with a bachelor's in one of the mental health fields or education fields. If it really feels like this is the career path for you, you can go to graduate school, get a graduate degree in one of the mental health fields, and then be able to work in IBHS as a graduate level professional doing the key roles for IBHS.
If you're passionate about helping children and families thrive, IBHS offers you the chance to turn your education into real impact, transforming lives. Every life change starts with one decision. If you're ready to make a difference for your community and for yourself, this is where it begins.